Well, good afternoon, everyone. I am Greta Brown with the Alzheimer's Association. I am the program manager for the Alzheimer's Association for West Tennessee. And I want to thank you for taking some time to come and be a part of this discussion on what you need to know about Alzheimer's disease. I'm sorry, Julie, you know what? Was I supposed to allow you to start first?
No, sorry. Absolutely. You go ahead. We just are so thrilled that you are with us today, on behalf of the entire team at the farms at Bailey Station. We're excited to be partnering with the Alzheimer's Association and the Tennessee chapter. And I know I'm excited to hear your update today. And so I'm going to go ahead and turn it over to you. And we are recording today's session. It will be posted to the website. And we'll take some time at the end of the presentation for questions. And so if during the presentation anyone has questions, if they want to put it in the chat, I can help facilitate that when we finish. So I'm going to turn it over to Greta. Thank you again for being with us today.
All right. Oh, thank you so much, Julie. So I want to thank Julie and everyone at the Farms at Bailey Station for coordinating this event today and for having me and allowing us to come and share this information with you. So I am going to first try to share my screen here. All right. All right. I think we're ready to get started. So let me just move this box. We have some things in the way here. All right. So again, I am Greta Brown with the Alzheimer's Association Tennessee chapter. The Alzheimer's Association is a worldwide voluntary health organization dedicated to Alzheimer's care, support, and research. Our mission is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And today, you're allowing me to come in and have this conversation. That is exactly what driving risk reduction and early detection is. It's having a conversation, communicating about the disease so that families learn more and can act on what they're learning. So let's first start by taking a look at Alzheimer's disease in the US right now. More than 6 million American seniors, I should say, 65 plus, are living with Alzheimer's disease. 1 in 3 seniors dies with Alzheimer's or another dementia. Now, something that's not shown here, and I think is a statistic that we should all keep in mind, is the fact that Alzheimer's now kills more people than breast cancer and prostate cancer combined. So you can see why the need to increase conversation around this disease is so great. Additionally, as a result of COVID, you see here, there's a middle box that says Alzheimer's dementia deaths have increased 16%. That is as a result of COVID-19. There were 42,000 more deaths from Alzheimer's and other dementias compared to the average over the past 5 years. This disease also places a heavy burden on our healthcare system. You see at the top of the screen, it shows that Alzheimer's and other dementias are costing our nation in 2021, cost the nation $355 billion. But it is expected that because this disease is expected to grow exponentially by 2050, the cost is going to grow as well. And it is expected that it will cost our country $1.1 trillion just to manage this disease. Currently, there are over 11 million caregivers in the United States caring for someone with Alzheimer's or dementia. And I want to also share some numbers with you for our state. So locally in Tennessee, we have 120,000 people living with the disease and 357,000 people serving as caregivers. We know that nationally, caregivers provide an estimated 15.3 billion hours of care, and that care has a value of $257 billion. So we really need to talk about this disease. When you see these numbers, it really shows the impact that this disease is having on our community, and really, to me, emphasizes the need for increased conversation. I want one of the things that I want to do today is to first look at the difference between Alzheimer's and dementia before we go any further into the presentation or into our discussion. I don't even want this to be a presentation. Dementia is an umbrella term used to describe a range of symptoms associated with cognitive impairment. Now, dementia can affect cognitive, behavioral, or your psychological being. And it's brought about due to biological changes occurring in your brain. Now, we're going to have a slide in just a little bit that kind of talks about what those biological changes are. Mixed dementia is very prevalent. Some causes of cognitive decline are reversible and not truly dementia. So here is the difference. Dementia is an umbrella term. Alzheimer's is simply what causes dementia. And it is believed that 60 to 80% of dementia cases are brought about because of Alzheimer's. So when we hear people use the word Alzheimer's and dementia interchangeably, they're not the same thing. One causes the other. There are also other forms of dementia or other things that cause dementia. So you can have vascular dementia, Lewy body dementia with Lewy bodies, or frontotemporal dementia. Now, vascular dementia, because it is also kind of one of the more prevalent forms of dementia, know that vascular dementia comes about when we've had some type of interruption to the blood flow going to our brain. So if you've perhaps had a stroke, maybe you've had a heart attack, that could possibly lead to you eventually developing vascular dementia. And so in a little bit, we're also going to talk about why it's important for us to take care of our heart and to eat well. Now, on this slide, we're looking at a healthy brain and then a brain that has advanced Alzheimer's. So when I talked earlier about Alzheimer's or dementia coming about being the result of biological changes in the brain, it is believed that the buildup of beta amyloid protein on the brain, it basically builds up and then creates clusters, and then eventually settles in between the brain cells and begins to kill the brain cells. There is also another protein called tau. Tau actually develops inside of the brain cells and it looks like strands. And so then the strands become twisted around one another. And then when they become twisted, they're not able to really do what they're supposed to do insofar as providing support inside of the cells. So in this photo or in this picture, we see that a healthy brain is completely full. There are no spaces. You may see a few spaces here and there, but when you compare it to the one to the right, do you see the holes that are literally developing in the spaces of the brain? That indicates and represents brain cell death. So those brain cells are beginning to die, or they're now dead. So the reason that we want to continue to have more conversation about this disease is so that people can understand what happens in the process and perhaps how they can slow the process down or impact the process in some way. Now, what we believe, and I think this is so important to remember, is that before or by the time you have experienced your first symptom of dementia or of Alzheimer's, biological changes began occurring in your brain 10 to 20 years prior to your first symptom. So if I am 55, I'll be 55 this year, and we do have now 200,000 Americans living with what's called younger onset Alzheimer's. If I am 55 and beginning to have symptoms of this disease, that means that at 35, possibly, biological changes were beginning to occur in my brain. This is why it is so important for us to begin to have conversations with all age groups and all communities. If you were told 20 years before, hey, if you changed your diet, if you got more exercise, if you followed these guidelines, it would decrease your chances of developing this disease, you probably would make some changes in your lifestyle. And so that's why we are wanting to increase the conversation around this disease and around prevention. One of the things that I think is very interesting about Alzheimer's is who it seems to be impacting the most. Women. Almost 2/3, which is over half, of Americans with Alzheimer's are women. Additionally, this disease tends to impact African Americans, Hispanics, more so than whites. And so what we know is that Black people and Hispanic people are 2 times and 1.5 times, respectively, more likely to develop this disease than their Caucasian counterparts. We're not quite certain why, but one of the things that we believe is that some of the other comorbidities that those racial groups tend to have and to lead the way in. So African Americans tend to lead the way in, and Hispanics, in diabetes and hypertension. With every comorbidity, and this was a study that was done, I believe, out of Michigan State University, with every comorbidity that you have, every additional disease that you have, your likelihood of developing some form of dementia increases by 23%. So when we look at the fact that these particular racial groups are leading in other comorbidities, it could explain why they are also more likely to develop some form of dementia. Ethno-racial groups have been historically underrepresented in clinical studies, underscoring the need for more diversity in dementia research. So here's the thing. Because these groups are being impacted or affected more so than others, we want to make sure that our research is also centered around them. We want to make certain that when we find a cure, that cure will actually work for all racial groups and not just one particular racial group who was more involved in the clinical trials. So it's really important that we that we have variety and diversity in all of our clinical trials. So on this screen, we're going to look at what may impact your risk of developing this disease. I think I have one more bubble there, yes. Here's what I want you guys to remember. Age, yes, it's a major factor. It's a primary factor in an individual developing Alzheimer's. However, if you don't remember anything else that I tell you today, there are a couple things that I do want you to remember. And one of those is that developing Alzheimer's or some other form of dementia is not a normal part of aging. You should not expect to develop this disease as you age. Genetics can also play a role. We often have people ask us, if my mother had it or if my father had it, does that mean that I'm going to have it? It means that you may be at a increased risk of developing the disease, but it does not guarantee that you're going to develop the disease. There are two types of genes that doctors can look at. One is called a deterministic gene, and the other is a risk gene. If you have the risk gene, then you're simply that you are at risk for developing the disease. Now, if you have the deterministic gene, then yes, that would determine that would say that you are probably going to develop the disease. So you might want to see a physician if you have questions and concerns about family members. Now, what we do know is that if a parent or a sibling had Alzheimer's, then it does make you, it does increase your chances of developing the disease. But again, it doesn't guarantee. Race and ethnicity, I just spoke about in the previous slide. So these are considered non-modifiable risk factors. Those things that are listed in the purple bubble, those are things that we cannot change. But when we look over in this orange bubble, this is where I get excited. These are modifiable risk factors. These are things that you can control. You can control your environment and lifestyle factors, which really include your cardiovascular health, physical activity, sleep, social and cognitive engagement, education, and then just protecting yourself. So I'm going to go back to this. Let's talk a little bit about cardiovascular health. So I'm going to take off my Greta Brown hat, my Alzheimer's Association hat, and put on my Greta Brown hat for just a moment. There is a statistic that I think is so powerful, and we actually have it on, I believe it's our Tennessee statistics, but what we know is that cardiovascular deaths that are resulting from heart disease are actually down over 7%. They have declined. Alzheimer's related deaths are up over 140%. Now, some of that increase could also be because we now are able to detect the disease, and we are now labeling that at the time of death, whereas before, perhaps we were not doing that. But I'm really more interested in you focusing on that smaller number anyway. I believe that heart-related deaths are down because there has been an increase in heart health conversations. So all of us have heard, lower your intake of saturated fats, drink more water, eat more vegetables and fruit, make sure you're getting exercise and you're getting your blood pumping through your heart. And by the way, one of the reasons why it is so important for you to make sure that you are that you have good blood flow going through your heart is that 25% of blood pumped from the heart goes to the brain. So what's good for the heart is good for the brain. I want you to remember that. That's so important. Physical activity. It's so important for us to be active. We need to control our weight. We also just need to keep our bodies moving. You need to keep strength going. So that's important. Sleep. Now, this is the one that I sometimes get a little stuck on because this is so important. Sleep is a major part of you lowering or preventing some various forms of dementia. So there is a cleansing process that occurs while we are asleep. While we're asleep, and I mean in a deep sleep, not in that light sleep where the TV's still on and your cell phone's next to your bed and it's buzzing during the middle of the night and you wake up out of your light sleep and you're responding to people or you're checking to see what the buzz was about. Everything off in a deep REM sleep. What happens is that some of that beta amyloid protein that I showed you in the previous slide that builds up in between the cells of your brain and then kills the brain cells, The cerebral fluid flushes away some of that beta amyloid protein. So there is an important, very important cleansing process that occurs when you're asleep. I also want to encourage you to make sure that you're getting enough sleep. Sometimes you can get too much, and sometimes you don't get enough. So make sure that you're getting about 7 to 8 hours of a deep sleep. And I know that sometimes if we work, we have nurses and doctors and people in the medical profession and police officers and firefighters, and their schedules are not, I go to the office from 9 to 5. I may be mill workers. I may be going to work at 11 o'clock at night, and I'm going to work all night, and I get off at 7 o'clock, and then I come home. And so your day is my night. Well, what I want to encourage you to do is to make sure that you are creating a day-night environment that would really mimic an environment that is truly nighttime. So you might have to invest in some window darkening treatments. Make sure that the house is as quiet as possible. I just think that those things are important when you are trying to really get a deep sleep. And when we think about how important sleep is, it's important for you to really have undisturbed sleep. Social and cognitive engagement. This is important because it really keeps us kind of on our toes insofar as communication. One of the symptoms, we have a class called the 10 warning signs. And one of the 10 warning signs of Alzheimer's is that you begin to lose your words. You may begin to withdraw from social engagements and social activities. It's important for you to stay involved in those kinds of engagements and activities so that you do kind of keep your vocabulary moving and you keep it going. Imagine that if you completely withdrew from activities and talking to people, if you really were beginning to experience losing a vocabulary, or losing a word, pulling yourself away from others is not going to help you to regain that. And so I want to really emphasize the importance of remaining social and even just challenging your brain. And that kind of goes into education. There are a couple of things that we want to note about education. One of the reasons that we believe that education is an important factor in lowering one's risk of developing the disease is that, one, it allows you to continue to challenge your brain. What we believe is that when the brain is being challenged and you are like really utilizing all of those brain cells, it actually creates new brain cells. And so the thought is that if you have the disease, if you lost some brain cells, because you would have new ones being developed with your challenging your brain, then you might not have so much of the outwardly symptoms of the disease. Now we have a doctor in Nashville, Dr. Hutchins, and he does this incredible example. I'll grab my phone here, where he holds up a cell phone and then a piece of paper, and he asks the audience, oh, you probably can't see because I have my background on, but he basically asks the audience, if I began to pour water down one of these items, which item would it reach the bottom of first? Well, clearly, it's going to reach the bottom of the cell phone first because the cell phone is smaller. The space is smaller. When you challenge your brain with learning new things, not necessarily word puzzles and things like that, but we want you to really challenge your brain. You might learn a new language. You might learn how to play a new instrument. I've always wanted to learn how to play the piano, and I haven't done that yet, and I'm going to do it. I don't care that I'm almost 55. I'm going to do that. So if there are things that you've always wanted to do and you've not done them yet, now is the time. Traumatic brain injury. One of the things that you can do to actually decrease the chances of you having a traumatic brain injury is when you're driving, make sure that you wear your seatbelts. When you're riding a bike, make sure that you have a helmet on. We know that traumatic brain injury can lead to a form of dementia. And I think we've probably heard a lot about that with, sports and athletes. So I've kind of already talked us through this. I do want to, though, on this page, talk about healthy diet. So sleep and diet are major. One of the diets, and I hate to use the word diet because what I really want you to do is to consider this as a lifestyle change. But one of the diets that is recommended for brain health, good brain health, is the Mediterranean diet. The Mediterranean diet is full of leafy vegetables, lean meats like chicken and fish. It does include an occasional glass of red wine with dinner, but also be careful because there is also a form of dementia called Korsakoff syndrome that you can develop from excessive alcohol, excessively drinking alcohol. So I want to encourage you to drink red wine in moderation, maybe with dinner a couple of nights a week. The other part of the Mediterranean diet that is very important for brain health is fruits. And the fruit that is recommended in this diet are berries, any kind of berry. Blueberries, of course, being at the top of that list. Blackberries, strawberries, berries have great antioxidative properties, and so they make great fruit for brain health. And I typically say to everyone when I'm presenting, my refrigerator is full of berries. I would encourage you to add those to your grocery list. Behind the various research efforts fueled by the Alzheimer's Association, advancements are always happening, but not just in one area. Research occurs on every front line across disciplines, fields, and industries. Milestones are being achieved. At any given moment, research and learning discoveries are happening. So on this next screen, what I really want to share with you is the impact that the Alzheimer's Association is having in research. We are not just a national organization, we have a global footprint. Currently, the Alzheimer's Association is funding over $250 million, or has over $250 million funded in 730 plus projects in 39 countries. And those 39 countries cover 6 continents. So when I say that we are dedicated, going back to our mission, when we say that we are on a mission to end Alzheimer's and all other dementia, we truly are trying to do that, realizing that it's going to take all of us coming together. On this next screen, while we're talking about research, I would be curious to know, and maybe we could put it in the chat box. I can't really see the chat box, Julie, but how many people think that Alzheimer's can only really truly be diagnosed at the time of death in an autopsy? Because that was the case. And maybe I've given you the answer.
Yes. Somebody said yes.
Okay, so lots of things happening in research. The answer to that is now no. So many advances. The Alzheimer's Association actually funded a doctor out of the University of Pittsburgh many years ago to develop a PET scan imaging that could detect that beta amyloid protein. And so today you can actually go to a doctor and have a brain scan have your brain scan to determine if that protein is present on your brain. what's on the horizon is amazing. We are getting very close to having a blood biomarker. So all of these, anything that tests something. So, for example, if you took a blood test, it might test if you have diabetes. So that's considered a biomarker. The brain imaging is now one biomarker that is in place. Emerging biomarkers that are coming now include blood biomarkers and an eye biomarker. So we are working toward your being able to go to the doctor and take a blood test to determine whether or not you might have Alzheimer's or some other dementia. You might also be able to go to your eye doctor to have your eye doctor scan your eye to see whether or not you might have some form of dementia. So oh my goodness. I got a little ahead of myself. So advances toward more effective treatments and interventions are definitely in the works. And what we want you to know is that a lot of these drugs that we are looking at, a lot of the treatments that we're looking at, these treatments would address issues of memory, learning, thinking, planning. They would also address depression, anxiety, delusions, hallucinations, apathy, agitation, and sleep disturbances. Now, there are current drugs on the market that actually already address some of these things. So what we want to remember is that right now, there is no drug that will take away Alzheimer's. There is no drug that will necessarily prevent you from getting Alzheimer's. Now, we do have the new drug that's on the market, Aduhelm, but I want to remind everyone that while that drug is about slowing down the progression of the disease, you have to qualify for that drug. So first of all, that drug only works if you have the presence of the beta amyloid protein on your brain. If you don't have the beta amyloid protein, then the drug is not a fit for you. Aduhelm is not for you. The other thing to remember about Aduhelm is that Aduhelm is also made for people in the very beginning stages of Alzheimer's. So if you have the protein on your brain, but you're in the middle stage, then you would not necessarily qualify for the drug. And so what's best is that you actually consult your physician and perhaps get with a neurologist to determine if you might be a candidate for that particular drug. But currently, most drugs treat the symptoms of dementia and not necessarily the dementia, other than the new drug, Aduhelm. Now, one of the things, I mentioned earlier about clinical trials and how important they are. And I want you to know that, as I said before, everyone being involved in clinical trials is so important. And so there are 3 types of trials. So phase 1 is basically a small trial that typically only involves about 30 or 80 people. It's typically focused on safety measures. And currently we have 129 phase 1 trials running. Phase 2 trials typically involve, I'm sorry, I did not mention that in phase one trials also are about or incorporate more healthy people. So we're looking at healthy individuals in that trial and then focused on safety. In phase 2, it involves healthy volunteers, but also some individuals who may be living with the disease. These trials tend to be a little larger in size, so you may have 100 or so people in these trials. Phase 2 trials are aimed at understanding the safety of an approach, but also start to address questions about whether a drug will really have benefit. Then in phase 3, now we have 191 current phase 2 trials. In phase 3, we have 62 phase 3 trials, and this is why that number is a little smaller than the others. Phase 3 trials are large. They typically involve only individuals living with the disease and can involve in upwards of 1,000 people or more.
We had a question that kind of relates to this slide. Are these trial numbers nationwide or specific to Tennessee?
Oh no, these are nationwide.
And are there any trials going on in Tennessee that if we had some of our members or our team members that wanted to get involved? I know sometimes during the walks in the past I've seen where you could sign up for a trial. Since we're talking about this, I'm sure that'll come up. How can people, if they want to get involved in a trial, get involved in one?
Okay, so in the next slide, maybe 2 slides, I'm going to share with you some information about Trial Match. And so Trial Match will actually allow you to register yourself to be put in a database so that when trials become available for you to participate in your area, you're notified.
Fabulous, thank you.
All right, you're welcome. And so I was saying about phase 3, and I should go back to say that some of these trials could also be occurring outside of the United States. I do believe that the majority of them are within the United States. So in phase 3 trials, we have thousands of volunteers, and these are the largest and most complicated trials in the pipeline. They are designed to understand not only the safety, but also the clinical benefit of a particular approach. So this next one, one of the reasons that I think this particular slide is so interesting to share in regards to trials and studies is that, I think a lot of times we think that trials are always about a drug, and sometimes they're not. They're actually about lifestyle preventions. They are about how you live and how you're taking care of other diseases. And so the Sprint Mind study is what we see here. The Sprint Mind study is basically a study that tested whether intensively treating blood pressure would decrease risk for developing cognitive impairment. They found that controlling blood pressure to a 120 systolic, which is the top number of your blood pressure, decrease the risk for developing mild cognitive impairment and dementia. This is significant because it tells us that there are things that we can do today to reduce our risk of developing mild cognitive impairment and maybe even dementia. And then US Pointer. So US Pointer is a 2-year multi-randomized clinical trial that involves 2,000 participants across 5 US sites. And here's basically what this trial study is doing. Do you remember those previous slides when I talked about all of the things that you could be doing to lower your risk? Your diet, getting exercise. That's what these people are going to be doing or are doing in this trial. So it is the first trial of its kind ever to be conducted in the US, but builds off of a successful trial basically that was conducted in Finland. US Pointer will test whether 2 lifestyle interventions encouraging physical exercise, a healthy diet, and cognitive and social activities can actually reduce memory, the risk of memory loss. So I want you to be aware that lifestyle intervention is major and it's important. I want you to begin right where you are. Try to start making small changes. Whether you are concerned, whether you have a history of the disease in your family or not, I think that it's important for all of us to really begin to live well. And this study shows that we are really trying to kind of confirm that through this study, that we're confirming this makes a difference. So here we are with Trial Match. So Trial Match right now, has over 350,000 users, over 300 plus clinical studies at 500 locations. I'm so sorry, guys. Trial Match is a free clinical studies matching service. So as I said, if you would just go to alz.org/trial match, you would sign yourself up. And then when a clinical trial was made available or is made available in your area, then you'll be notified. And I am actually registered on Trial Match or in Trial Match. So here's what we know, and I think this is such a powerful slide. If we develop a treatment by 2025 that delays the onset of Alzheimer's by just 5 years, and that's right around the corner. But look at this chart. If we can delay the onset of Alzheimer's by just 5 years, 5.7 million Americans who are expected to develop Alzheimer's would not. So I want to say that while the Alzheimer's Association and scientists and doctors all around the globe are working to find a cure for this disease, you and I can actually help them. There are things that we can be doing, as I've discussed, to actually lower our risk of getting this disease. So we can aid in reducing that number that is expected, that we're expected to be at in 2050. And I don't think I mentioned that in the first slide. So it is believed that right now we have 6 million people in the United States, or 60 seniors 65 and older living with the disease. It is believed that by the year 2050, that number will be nearly 14 million.
Wow.
Worldwide, there are about 50 million people living with the disease. And by the year 2050, that number is expected to be 130 to 50 million. So 150 million, I believe. So putting that in context, worldwide, half of the United States population would have Alzheimer's around the world. So such an important conversation to have. Our vision is a world without Alzheimer's disease and all other dementias. And having conversations like this, sharing our education programs. Like I said, we have one education program that covers the 10 warning signs. And I think that it's so important to know those signs so that you can see your doctor and you can address them early. That is what you need to know about Alzheimer's and all other dementia.
Gosh,
So,
thank you so much. I mean, I've personally had the opportunity to be involved with the associations for, now 15 years or more. And
wow.
Every time I hear these statistics, they're staggering. And over the time that I've been involved with the association, watching the numbers grow and the projections, I'm excited about what's happening with research and some of the things you mentioned. We did have a few questions.
Yes.
One question was, how does the U.S. compare to the rest of the world related to people that are suffering with the disease? And I think the question there is, where are we? Does the U.S. have more people with Alzheimer's, or how do we fare?
You know what? I want to share with you guys. We have an Alzheimer's. It's like an app. It's a science app that you can actually add to your phone. And we provide a lot of information about like worldwide statistics and how this disease is impacting other countries. Interestingly enough, there are other countries who are expected to have a bigger increase in this disease than we are expected to have. In fact, one of the countries that I was reading about, or one of the places that I was reading about, is Africa is actually going to have a kind of an increase in Alzheimer's and dementia cases. So there are again, why we make sure that our efforts are global, because this is not a disease that just impacts our country. It's impacting the world.
Well, thank you. We have another question, and this and with Karen, I had the same questions. Are PET scans now covered by insurance? That's the first part of a question, under Medicare or under insurance.
Now, I don't know about under Medicare, but if you have health insurance, like I have health insurance through the Alzheimer's Association, yes, I recently just had a brain scan, and it was covered through my insurance. Now, if you are wanting to take a scan to detect the amyloid beta or beta amyloid protein, I don't know that that is necessarily covered. That may be considered an outside, kind of test. And so I guess you would really need to follow up with your insurance company to see if they would cover you to have the test for that.
So you can have a scan to detect the tangles and the PET scan. Do you have to have any symptoms? Could I just, walk in, or do you have to have an underlying reason to have it?
Well, you know what? Let's just say, Julie, that you wanted to have the test because you had a parent that had the disease. And so you just want to know. I think that's a conversation that you would have to have with your doctor. And so if you just wanted to have some kind of, in a way, have genetic testing, I think that the doctor probably would coordinate that and could make it happen for you. So in essence, I don't think that someone would tell you no if you're saying, I'm concerned about this because I have some genetic ties to it.
Wonderful. And I think this is the last question. What percent of patients with dementia don't have the amyloid? So do people have dementia and not have amyloid show up? I guess this.
Yes, that we do have cases of that. I'm so sorry. I don't know the percentage, nationwide of people who don't have the presence of the beta amyloid protein. But there are cases of people who have tested positive for dementia, or perhaps Alzheimer's, but don't have the presence of the beta amyloid. Now, I'm going to remind you also that if you have another form of dementia, you may not have the beta amyloid protein. So if I had vascular dementia, I would not expect to find the beta amyloid protein on my brain. Or if I had Korsakoff syndrome, I may not have it, or some other form of dementia.
Okay, great. I appreciate it. Well, I know that we're so excited to continue our partnership with you, and I'm sorry that for many folks that will be watching this or are attending today, we had hoped that we would have been able to do this in person. Yes. But with the recent surge in Omicron, we felt it was better to do the Zoom, but we are really excited to be able to work with Greta and the rest of the Tennessee chapter and bring education to not only our members, to our team members, to our potential members. The farms being a new continuing care retirement community, Collierville promotes a lifestyle of where you can come and be fit and have social interaction and eat right and exercise and be intellectually stimulated. And one of those things will be continuing these seminars, with Greta and her team. And you are a phenomenal speaker. I knew that when I met you, and I know you did the call as well. And we're really excited to continue working with you. And
well, I'm excited to be here. And you know what? If there aren't any more questions, I think, didn't we have an hour for this session?
Just about. I have, and then someone just said they're grateful for Zoom safety and they appreciated it.
Yes.
Yeah, we took an hour just to be, on the safe side.
Well, I just wanted to say, you know what, I could very quickly, I think I probably could get it done in about 5 minutes. Just share some of the 10 warning signs before everyone left today, if that's okay,
Yeah,
or
let's
if you
do
want
that.
me to
Let's
save it for.
close. No, let's close with that because we've got the time. It'll be great because we're still videoing and we'll put it up on the site because I think they're important signs for people to know. So go ahead and then
Yes.
I'll
Okay.
close
So what
out.
I want everyone to remember is that first of all, that there are signs of normal aging. Okay. So some of these signs are also signs of normal aging. And so you may experience one of these, but it does not mean that you have Alzheimer's or dementia. It just means that you may need to check into it. And we're also going to I'm going to talk very briefly about the difference between normal aging, having this symptom be a part of normal aging, and having the symptom be a part of perhaps a symptom of dementia. So memory loss that disrupts daily life. When you cannot continue doing the basic things that you used to do, you're forgetting things, you don't know where things are, that might be a problem. Now, if you let's say you forget to go get your dry cleaning, or you forget to drop the dry cleaning off. Sometimes, and this will be the case for a lot of these symptoms, busy lives just have us forgetting things. And we need to remember that and give ourselves some grace. But when it's getting to the point where it's really impacting your daily life, that's a concern. Difficulty completing familiar tasks. So organizing a grocery list, going to the grocery store and perhaps getting lost in the grocery store because, well, now you don't remember which side of the grocery store the bread is on, but you've lived in the same community for 20 years. Trouble understanding visual images and spatial relationships. Now, be careful with this because we all have adjustments or changes in our eyesight as we age. As you age, you may develop cataracts, or you could just need glasses. But when perhaps your depth perception is a bit off, when you're driving through a stop sign because you don't recognize that red sign, that might be a problem. Misplacing things and losing the ability to retrace your steps. Now, this is major, and it kind of goes back to number one. If I lose my keys, but I am able to stop and think about what I did when I walked through the door. Okay, I came in, I went to the kitchen, and oh, they're next to the microwave. Oh, they're next to the toaster. When you come in and you've put your keys down and you have no idea where they are, if you don't even remember driving in the last hour, then that would be a problem. Withdrawing from social or work activities and engagements, when you get to the point where you're withdrawing from activities, not because I'm tired, not because, well, I just, I don't feel like being bothered with certain personalities, but because you know that you're going to have some difficulty in communicating, and so you would just rather not be bothered, that might be a problem. Problems in solving problems and planning. If you've always been someone who took care of your bills and everything was paid on time, and then now all of a sudden the bills are behind, perhaps you're over tipping, you pay the lawn guy $50 to cut the grass, but then you tipped him $40. That might be a problem. Confusion with time or place. It's summertime and you're talking about going to buy Christmas gifts, and not because you want to get started early, but because you're thinking, well, Christmas is like next week. That would be a problem. And especially if you see this in other people. New problems with words in speaking or writing. So I always give this example. We all sometimes lose a word. I'm in the middle of a sentence and I'll say, well, I want to talk to this group about the impact that Alzheimer's is having in the community. That's what I want to say. But I get to that and the word just leaves me. So what I do is I substitute it with another word. I say, I want to talk to you about how Alzheimer's is affecting the community. Okay. When you can no longer do that, when you get to a place, or when someone you love gets to a place and they lose the word and it's just gone, and then they become frustrated, that might be time, that might be a sign that it's time to see the doctor. Decreased or poor judgment, maybe not making the right decisions when you're driving, you're changing lanes, you're not using your signal, and some of us, again, we're just rushing and we're busy. But, you know, I'll share that I've seen this in a family member, and we're all a little concerned about it. It's more than just, she didn't put on a signal. It is that, oh gosh, she made a right turn from the left lane and thought that she was okay. And then lastly, changes in mood or personality. Now, again, we can all, you know, we get older, we get a little settled in our ways. We like things done a certain way. But if your loved one is exhibiting personality changes that are unlike anything that you've ever seen, that their mood is just perhaps maybe even borderline strange, or it looks like it might be a bit of depression, it's definitely time for you to see the doctor. So I just want, those are the 10 warning signs, and I just wanted everyone to at least leave this session today with that information as well.
Well, thank you so much. And thank you for everyone that is, with us today. We will, it'll take a few days to get the video processed and up to our website, but this was fabulous. And again, we want to do this presentation in person at the community. And so when we get down a little bit in the positivity rate and everyone gets the green light, we'll have Greta back. So thank you, Greta. Look forward to talking to you probably in the next few days, but thanks everyone. Have a wonderful evening and be safe.
Thank you, everyone.
Bye-bye.
Yes, be safe.